OHSU is the only academic medical center in the state of Oregon. We're a level 1 trauma center. We have about 530 beds, and that's distributed between OHSU Hospital and Dornbecker Children's Hospital. Today we have MobileView integrated with 6 different applications. We have it integrated with AeroScout system, which is our asset inventory and work order system. We also integrate MobileView with CareFusion for our pump management. We have it integrated with communication integrations. We go to Vocera badges, we go to our paging system. We also have an integration to an IP relay device, as well as a Cisco phone. Having the CareFusion pump status available in MobileView is helpful in a couple of different ways. One is when we need to go out and find a specific pump, whether it's for service or for, say, a software upgrade. If we need to find one specific pump, we can look at it. If it's in use, we may wait until the next day and grab it. If it's not in use, we can go grab it right away. It also helps us when we're looking at our pumps as a whole fleet of thousands of devices. We can look at the utilization, we can look at patterns, and see if we need to adjust any of our processes to better make use of our fleet. The integration between CareFusion and MobileView gives us really valuable information about how our pumps are moving around our facility. While they're on the units, we like to know how often they're running, when they're turned off, when they're actually placed in their soil utility room to be picked up. It gives us a level of insight that we've never had before. We've used the information to look at our process because we process every order from a nursing unit as an on-demand order. They need that pump right away. So we prepare it, they send it out to the unit, and that process takes time. It requires a transporter to come, make one trip to deliver one pump. We know that the transportation staff are very busy, especially during the morning and early afternoon hours. We've been able to look at the utilization data, look at how many of those trips that they're making during their peak hours, and evaluate whether those pumps were really needed right away. In some cases, we look at those pump deliveries and they sit idle, unused for 4, 8, sometimes even 24 hours before being used. That lets us know that not every order is an on-demand order, and we might want to reevaluate how we're processing those orders. Our equipment pool staff make regular rounds to soil utility rooms on all of our units to pick up dirty equipment. Those are scheduled in the evenings, and we wanted to see if that's really the best time of day to be picking up pumps. We looked at the time based on the CareFusion data when pumps tend to be turned off and pulled out of service, and we found a very nice correlation between when pumps are turned off and when equipment pool is making their rounds. This lets us know that we don't have pumps stacking up in the soil utility room, that we're getting those turned over very efficiently. We've considered moving from an on-demand model to a par-level model for years, but we've never had the data to help us know if that decision is right. Now with the MobileView integrations, we can see where our opportunities are, where our waste is, and how we can improve our operational efficiency.